Good afternoon, everybody. You're all really welcome this lunchtime. Thank you so much for giving up your lunch break to join us today. And we're really excited and delighted to be launching our research report today on social prescribing outcome measurement. My name is Aisling Sheehan and I'm the lead for the Alcohol and Mental Health and Wellbeing programmes in HSE Health and Wellbeing. And today we're going to be hearing from two researchers from Trinity College Dublin who've worked with us on this report, Aoife Ryan and Professor Deirdre Connolly from Trinity College Dublin. And you're mainly going to be hearing from Aoife and Deirdre for the first half of the webinar. And then for the second half of the webinar, we're going to have a panel discussion during which we're going to reflect on the findings of the report and the implications for policy and for practice. So we'll be joined for that discussion by Ethna Foley, who is a social prescribing link worker at Lacala Family Resource Centre in Mallow in Cork. We're also going to be joined by Emer Morahan, who's a Health Promotion and Improvement Manager in HSE Dublin South and Wicklow, and by Alicia Clark, who's the Programme Manager for the HSE Mental Health and Wellbeing Programme. So we'd really encourage you to put your questions into the Q&A box. And we will pick up as many of those as we can during that panel discussion. We may not be able to answer everything due to the time restraints today, but if there are any unanswered questions, we will do our best to review those after today's event and come back and follow up where required. There are a huge range of issues that would be really interesting to explore today. However, my role today will be to keep us focused on the topic of outcome measurement for social prescribing. I may need to park issues if other issues out of scope today. We will, however, endeavour to come back to those at a later date. And we will also be sharing at the end of the webinar a post-webinar survey, and we would love your feedback, and please feel free to offer any further suggestions and insights at that. We'll send that around later towards the end. I want to shortly introduce you to the researchers, but firstly, I just want to say a little bit of background to this piece of work. I know probably everyone on this webinar is really familiar with social prescribing or involved in delivering social prescribing, but just very briefly, for those who aren't familiar, social prescribing is a service that connects people to a range of community supports, and social prescribing link workers work with service users to co-design their personalised solutions to addressing their individual health and wellbeing needs. We know from research and from practice that social prescribing can offer many benefits, particularly in improving health and wellbeing and improving social connectedness. However, it has been challenging in terms of strengthening the evidence base for social prescribing, and the evidence base is subject to quite a bit of ongoing debate. Many of the studies and research that is out there, unfortunately, has a lot of methodological challenges and constraints. One of the big challenges to building the evidence base for social prescribing is around that diversity of outcomes that social prescribing addresses. There are such a wide range of service users with a wide range of needs. They may have chronic health conditions, be experiencing mental health difficulties, experiencing homelessness. So given this wide diversity and the wide-ranging needs that are there, the outcomes are similarly diverse and wide-ranging. So we're really keen in the HSE to work with our research and academic partners to strengthen the evidence base for social prescribing. And we believe that this is important for a number of reasons. We believe it's really important for informing us, are we meeting the needs of our service users, and how can we improve our services to better meet needs, as well as informing policy decision-making in relation to the investment in social prescribing. So back in 2020, the HSE produced a minimum data outcomes framework for social prescribing, and there was a lot of consultation to develop that. And through that framework, we have recommended that at a minimum, we should be assessing well-being and social connection as two key outcomes for social prescribing, notwithstanding that there are multiple other outcomes that social prescribing can address. So our next step then was to look at how could we identify standardised outcome measures. And there are a number of benefits to using standardised approach to measurement. It means that we can compare outcomes over time across different services. We can, it helps us to build our evidence base for social prescribing, to identify best practice, to improve communication about social prescribing. We're able to use a common language around outcome measurement. And from our perspective nationally, it's also crucial to enable us to collate and aggregate data at a national level to guide policy decision-making in relation to investment. So that's a key benefit from our perspective nationally. So given this, we commissioned this piece of research to look at how could we best measure outcomes in practice.
What we'll do now is we'll go on to the presentation in relation to the report.
Perfect. I'll just share my screen now.
Thank you very much. And Lisa, if you could maybe, that's perfect.
Okay. Is that sharing okay?
That's perfect.
Yes.
Thank you very much, Aoife.
Great. Thank you. Okay, so good afternoon, everyone, and thank you for having us. Today I'll be presenting on the research carried out by myself and Professor Deirdre Connolly from the discipline of Occupational Therapy in Trinity College, Dublin. The purpose of this report was to assess the feasibility, usability and acceptability of 3 outcome measures used across social prescribing services in Ireland. Today I'll be talking you through the rationale for undertaking the study, followed by the methodology and the findings. Professor Connolly will then discuss some of the implications for social prescribing practice and research going forward. So as I said, the aim of the study was to assess the feasibility, usability and acceptability of 3 outcome measures, and they were the Short Work Edinburgh Mental Wellbeing Scale, the Measure Yourself Concern and Wellbeing, and the Community Connectedness Scale. The Short Work Edinburgh Mental Wellbeing Scale is also known as the SWIMWEBs, and it measures a person's self-reported well-being over the preceding 2 weeks. Scores range from 7 to 35, with a higher score indicating higher well-being. The Measure Yourself Concerns and Wellbeing, also known as MyCaw, asks a person to rank first their concerns and then their well-being on a scale from 0 to 6. The MyCaw then measures the change in a service user's concern from baseline to follow-up. Higher scores then indicate a greater concern. The Community Connectedness Scale measures service users' self-reported connection to their community through 5 questions. Scores range from 5 to 25, and a higher score indicates a greater community connection. I know, as Aisling was speaking to, but these outcome measures were chosen because of the HSE evaluability framework, and that framework identified that social connectedness and personal well-being are the minimum outcomes to be measured. Within this document, the SWIMWEBs was specifically measured as a potential measure of well-being. The MyCaw was also chosen to be included in this study due to its widespread use both internationally and across social prescribing services in Ireland. Social connectedness was also recommended, was a recommended outcome to assess within the evaluability framework. The HSE Mental Health and Wellbeing Programme completed a piece of work exploring the literature for a suitable tool that would measure that social connectedness piece within the context of social prescribing. At that time, an appropriate measure was not available, and therefore this community connectedness scale was developed through a consensus-based process. And of course, this report is about feasibility, usability and acceptability. But what do we actually mean by that in the context of social prescribing? For feasibility, we were posing questions around, was it an appropriate measure for social prescribing services? Is it a good fit for you and for your service? And of course, for the people who attend your service. In terms of usability, we were exploring whether it was easy to use. Was it easy to use within your practice and for the people who attended your service? Was the language and the length accessible? And acceptability. Did you actually like using the measure? Are you confident in using it? And would you continue to use it again in the future? The study design was a mixed method design, meaning we collected both quantitative and qualitative information. The aim at the outset was to include 10 link workers and 50 service users across CHO 4, 6 and 7. And we asked link workers to complete the questionnaire with service users at that initial meeting, and then 6 to 8 weeks later following the first meeting, or at the end of their involvement if sooner than 6 weeks. In terms of data collection, what was asked of the link worker was to administer that baseline and follow-up questionnaire with their service users, to complete a logbook that reflected on their use of the questionnaire, what went well, what didn't go so well, and what might they change for the next time they did the questionnaire. And then they were asked to partake in a semi-structured interview. The service user, of course, completed the baseline questionnaires and follow-up questionnaires, and then they were invited to a interview following the completion of questionnaires at baseline. In terms of findings then, we had 9 link workers participate with 8 interviews completed and 8 logbooks completed. We had 43 service users at baseline and then 33 completing the follow-up questionnaires, which gave the study an overall retention rate of 77%, which was quite high. We then completed 20 interviews with service users. So this is the service user demographics in terms of the questionnaires. Of those 43 service users who completed the questionnaires at baseline, the majority were female with an average age of 57 years, and this age range ranged from 24 up to 93. Just under half had completed third level education, and with a small number having left education prior to completing primary school. The majority were unemployed and on long-term illness benefit, with a small minority in employment. The reasons for referral and why they came to social prescribing was seeking psychological support and for social isolation, which would tend to be the typical reasons we would see people presenting to services. So we first wanted to see the quantitative findings, and with the quantitative findings, we hoped to see whether the measures were sensitive to change and whether they had that ability to detect change for service users. Overall, for the swim webs, there was a statistically significant increase in service users' well-being from baseline to follow-up for the majority of service users. And this was again reflected in the community connectedness scale. There was a significant increase in service users' connection to their community. And for 32 of the 33 service users who completed the follow-up, they reported equal or improved well-being, which is quite high. In terms of the MyCaw, the Measure Yourself Concerns and Wellbeing, a total of 78 concerns were recorded across all baseline MyCaws. That was concern 1 plus concern 2. Service users can name up to 2 concerns in that baseline MyCaw. And the top area of concern that was observed was around that psychological and emotional concerns, followed very closely by wellbeing concerns around taking time for the self or for nutrition or for looking after yourself. The area of concerns that were less identified were around practical concerns like going back to work, or around physical concerns like weight gain or weight loss or lower energy levels. Again, with the MyCaw, there was that statistically significant improvement in service users' concerns and in their reported well-being from baseline to follow-up. An additional strength of the MyCaw is the 2 open-ended questions that it includes. The first one focuses on other things affecting health, an increase in awareness of well-being was most commonly reported by service users when they cited what was affecting their health most. As well as this, the MyCaw also asks service users to report on what has been important to them during their time in the service. And the majority of service users reported that it was the support and understanding and that trust that they developed with their link worker that was most beneficial to them during their time in their services. Overall, sorry, that just went a few slides ahead. Excuse me, apologies for that. Overall, the quantitative findings appear to indicate that the measures are sensitive to change and can detect that change from baseline to follow-up. Now, in terms of the qualitative findings, so these qualitative findings come in the form of semi-structured interviews. The majority of the service users who took part in interview were women with an average age of 63 years. The majority were not working at the time of interview, with more than half having attended third level education. As well as this, we had 8 link workers who completed the interviews, with a fairly even spread across the 3 CHOs. From the interviews of both the link workers and the service users, 4 themes were identified, and these were the experiences of using the questionnaires, considerations when using them, and then as well the benefits and the barriers, and I'll discuss each of these in detail now. I'm sorry, this is quite a busy slide, but I just want to give you the highlights of the acceptability, usability, and feasibility. So for the swim webs, it was easy to complete and laid out in a very accessible format. It was easy to read, it was an appropriate length. However, there was some difficulty cited by service users around 2 questions, and they were, "I've been thinking clearly" and "I've been feeling useful," which were said to be difficult to answer. And this difficulty wasn't due to the complexity of the language contained within the questions, but rather that they required service users to kind of take a step back and examine and articulate their mental health and how they were feeling in a way that they might not have done before. The My Call was again clear and unambiguous, and the scale that was included was made easy to understand by the inclusion of happy and sad faces at either end of the scale. However, there was some difficulty with, there was some changes made to the measure by link workers. Some link workers reported that they tended to change the wording from problems and concerns to goals. As one link worker explained, they felt that it might be a bit easier for service users to articulate what they wanted rather than what they were concerned about or what their problem was. And finally, the measure of the community connectedness scale was easy to explain and to complete. It again had that strong ability to identify how the person was feeling and their connection to the wider community. However, there was some difficulty noted around the working definition of what actually was community in the context of this measure. As one service user described, they were unsure how to answer it. Was it community in the people around them, like their family, or was it that wider state piece or their neighbourhood? So there was some difficulty answering there. As well as this, there was many considerations given when completing the questionnaires, especially in the context of timing, the format, and the flexibility needed. Ultimately, the majority of both groups, so service users and link workers, preferred to complete the questionnaires at that initial appointment, with some of both groups preferring to do it at a subsequent appointment. As one service user said, that they felt that they were a completely different person at their second appointment, so having that baseline was really important to them when they first started in the service. When delivering and completing the questionnaires, the majority of service users reported that they preferred that in-person conversational approach to completion. But there was ultimately a need for a tailored and flexible approach when completing them with service users. There was some groups highlighted by link workers, especially those who they consider to be emotionally vulnerable, who might need a more tailored approach to how they're being completed. In terms of the benefits of questionnaires, there was lots of benefits identified by both link workers and by service users. Link workers felt that they were really helpful in building that relationship with service users at the initial meeting, and it really generated discussion on how the service user felt and delved deeper into how they were feeling. It helped them to understand how their service user was feeling at that time, and it also gave appointments a nice structure, so a nice start, middle, and end. For service users, the majority, so 16 out of the 20, expressed positive feedback to completing the questionnaires. It really helped them to understand how they were feeling, especially at that first appointment, and being able to look back at how far they came once they had completed their time with social prescribing. It helped them to understand and think about what they might like to be involved in and to set goals in the future. As one service user described, it really added to the sessions, and they felt it was great to be able to quantify how they were feeling at that time. In terms of barriers to the completion of outcome measures, there were some barriers, as with anything. Some link workers cited that it didn't help them to understand their service users any more than a normal conversation might have done. The minority expressed that the outcome measures only captured how a service user was feeling at a very specific point of time. So if the service user had been having quite a bad week or quite a good week, that the results would tend to skew either way in a way that might not really reflect how they were feeling in general. The measures also don't assess physical health. There's no questions around physical health in any of the questionnaires. A small number of service users, so 4 out of our 20 service users, expressed that they didn't really like completing the outcome measures. And in general, there was 2 main reasons. The first of which was just a dislike for completing paperwork. Some people really didn't like filling things out, and they would have preferred to have done it through a conversational approach. But as well as this, there was a lack of understanding of social prescribing, which sometimes caused confusion on the content of the measures and why they were being asked certain questions, especially when they were related to mental health. And this misunderstanding is seen here, especially with the service user quote. This service user described not really expecting to be asked all those questions. They were just expecting to be talked about, to talk about courses and other areas of referral. Now, so then what does this mean for the future of social prescribing? What are the implications for practice and for research? I'm going to pass over now to Professor Connolly, who'll discuss the future implications of this research.
Lovely, thanks Aoife, and thanks for doing a great job on presenting so much information there in a very condensed format. Like I suppose that, you know, it was great to do this research. It's something that we've talked about and in terms of the importance of measuring the outcomes. And, you know, we've always talked about maybe having a common set of outcome measures. So it was lovely to actually, you know, trial these measures and see if that's something that we can try and identify kind of what would those kind of common measures be. So I suppose the first thing we kind of felt was important to emphasize that we were never looking to, you know, to compare these 3 measures to see, you know, is there one of them that would be kind of the optimal to use within the services, because as Aoife explained, they're actually measuring quite different constructs of social prescribing. So even though they're all connected to kind of the bigger umbrella of well-being, they're looking at different elements of well-being. So I think that's important to recognize. I think if you're, you know, what came across was that if you're important to have consensus between service users and social prescribing staff, what's the aim and purpose of your service? And then that'll help you to identify, you know, which of these measures are going to be relevant for your service. What came out quite strongly, and again, I think this was interesting, that service users actually do like to complete the measures at the first appointment. I think we've always had some idea that it put people off at that first appointment. But I think one of the service users articulated it very nicely that, you know, it gave them that baseline and also even after the first meeting, you're already beginning to change and maybe benefit from the service. Flexibility, really important. I think, you know, there's no one size fits all. So for some people, maybe you might give it to them before they come to the service. Others, you know, like to do it in person. Really important to complete those follow-up measures. And I know, again, you know, working with staff in different services, it can be really hard to get that. But again, maybe think about using different administration approaches. It could, like, in person is optimal, but maybe by the phone. Aoife set up a Google Forms, and the link workers were able to send that out to the people who participated in our research. I think training is needed, again, just because we all have a tendency to interpret questions and measures in a slightly different, you know, albeit nuanced way. I think, again, it's probably important that we do have some common approach to using the measures. Efficient data collection systems, and I think this is something we hear a lot of, but again, you know, that was evident from the research that easy data collection for staff and service users. training, I think we really need to look at this, and it came out strongly from the service users who say, you know, they had no idea why they were being referred to social prescribing and therefore didn't know why they were filling out the questionnaires. And I think we really need to, I think as a group, nationally, is there a kind of a common training framework we could develop for healthcare professionals and other people referring into the service? And that service users need to be very clear on why they're being referred and therefore why we're using certain measures within the service. The next slide, Aoife, please. And then in terms of kind of moving forward with the research around social prescribing, based on this study, I think the community connectedness tool really showed that it was easy to use, it was relevant. There was some confusion, obviously, around some of the questions. So I think it would be lovely to get some further development around that community connectedness scale. If we can keep it to 6 or 7 questions, and really the nugget of what, you know, that linking to the community would be great to develop that. And the MyCall, you know, SwimWebs is more straightforward to use, but I think we could still need to do a bit of research around, you know, using those measures across different models of service and different user profile. Again, a bigger, probably national and international focus would be to look at developing a core outcome set for social prescribing. So again, you know, Aisling was talking about having some standardization to be able to compare services. I think, again, a common referral form, really, really important, because I think that'll help users to be clear why they're going to social prescribing, and then obviously why we're using certain measures. And obviously, you know, for the link workers themselves, there's all sorts of reasons why that's important. And then also maybe to see, is it possible to have a standardized definition of social prescribing? I'm not sure there is, but we could aim for, you know, maybe some level of commonality. And then just the final slide, Aoife. Just Aoife and I are really grateful for this research. We both enjoyed doing it so much, and we couldn't have done it without the link workers. Many of you who are on the call, who helped us to design the study, advised us right through all stages. The service users who participated in the study, again, it's a commitment, and we're really grateful for that. HSE Health and Wellbeing for funding the research, but particularly also Orla and Alicia were hugely important in terms of carrying out the research, in terms of the guidance and the support. And we had multiple meetings and questioning and really interesting debate. So just want to particularly thank both of them. So thank you very much.
So Aisling, if you want to put on your camera, here she's
Yes,
back.
I'm back. Sincere apologies for my technical issues earlier. Thank you so much, Aoife and Deirdre. That was a fantastic overview of what I think is a really thorough and really valuable piece of work. And I'd also like to echo the thanks to my colleagues Orla Walsh and Alicia Clark, who I know worked really closely with you on this, and to all the link workers and service users who took part in the research. Yeah, we're really, really pleased, and we think it's going to be really, really valuable in terms of informing our next steps, which we'll get into now in the panel discussion. Just something that I didn't mention before I got cut off, and it may have been mentioned already, but just we are recording today's session, and we will be sending the recording to everybody who registered for the event, alongside with any follow-up material. And also just to say, I think this report and this piece of work really clearly articulates some of the challenges with moving towards a standardized approach to outcome measurement, particularly the challenges around IT and data collection. So that is something that we are actively pursuing at the moment. And so at the moment, we're encouraging social prescribing services users to use outcome measures for their own practice to inform their own work. We're not asking all service providers to collate and to report to the HSE on these measures yet, but we do hope to be in a position to do so once we address some of those challenges that are there. IT is certainly one, and there's others that you've outlined in your report as well. So we can pick that up a little bit more in the panel discussion. I just wanted to say that just at the outset. I see that the panel members are now joining us, which is fantastic. So if you want to turn on your cameras, and I will introduce you again. Just thank you to Alicia Clark for joining us, the Programme Manager for the Mental Health and Wellbeing Programme in the HSE, to Esma Foley, who's from the Lacela Family Resource Centre in Mallow in Cork, the link worker there, and to Emer Moran, who is a Health Promotion and Improvement Manager with the HSE in HSE Dublin South and Wicklow. Thank you so much for joining us, and we're going to pick up on some of the findings of the report. To everybody watching, we'd really encourage you to pop any questions or comments that you have into the chat, and I see we have a question there that we'll pick up on very shortly. So I might start with you, Ethna, if that's okay. I think it's been, I'm sure you'll agree, really interesting to see the variety of experience captured in the report on people's experience of using the measures, both from the link worker and the service user perspective. Could you tell us a little bit about your personal experience of using outcome measures and what you see some of the benefits and challenges of using them?
Sure. I mean, I think a key benefit is, as has been mentioned here in the presentation, a lot of people who come to social prescribing don't really know what it is. So you often ask somebody what they'd like to get out of social prescribing, and they kind of don't really know how to put language on that, or don't really know where to begin. And so I sometimes find in those kind of conversations that filling out a wellbeing measure, it just gives you some structure. Then you're able to say, okay, so you rate yourself really high on this measure. How are you managing to do so well on that? And here is a bit lower. Is that something we want to work on maybe? So it gives structure for both the person coming in and also the link worker. So it can be very beneficial from that point of view. And then in terms of towards the end of the process, when you get a second measure, which doesn't always happen, but when you are able to get a second measure, to then be able to look at the numbers and be able to say, so, your number was such a thing and now it's such a thing. So how are you feeling about that? And they can see themselves, hopefully, the improvement they have on at least some of the measures.
Yes, brilliant. And I see a question in the chat from Danielle. I think this is something that came out in the report as well. Sometimes the challenge of doing the measurement on that first visit. Yeah. Do you have any reflections on that, Ethna? It's sometimes
it's a very tricky one. I always tend to do it on the first visit, partly because you want to capture how the person really is prior to social prescribing, because sometimes at the end of even one session, the person is feeling more hopeful and more aware of what's gone in their community, that they've really been listened to. So it's a tricky one. But also I think sometimes somebody can be more honest if they have more of a trust built up over a couple of sessions with the link worker. So that can be very tricky as it's very subjective. Do you know what I mean?
Yes. Aoife and Deirdre, do you want to make any comments on that just from the research perspective? I know that this is highlighted in your report, that you got some feedback from some people about some of the challenges of doing that in that first visit.
Yeah, I think, there's no easy solution to it in a way, Aisling. I can totally understand, that idea of building the rapport and putting people at ease. And I was just having a look there in the chat box as well. And Danielle is making the comment in terms of, sometimes with an older cohort that, some of the language is difficult as well. But I think if we really, and I suppose it comes back to, are you using the measures to measure, impact, or are you using the measures to try and direct your intervention and interaction with the service user? If we're using it to capture impact, which I think we badly need to do, it's really important to do it on that first visit, if at all possible. And I suppose that's where being able to kind of have different approaches, like do it maybe in a conversational way, to gather that information or do it, you know, maybe sometimes people are happy to do it maybe while they're waiting, you know, to come in and see you. So it's about, I suppose, you know, working out that approach with your service user in terms of, you know, the profile of people who are generally using your service would be my thoughts on it.
Thanks a million, Deirdre. Did you want to add anything, Aoife, to that?
I was just going to echo the same as Deirdre, that it's really that flexibility piece that is so important when completing the questionnaire with service users, and it was echoed within the research findings that people really valued being able to have that conversation with their link worker and say, no, I actually really want to do this with you and fill it out together, or else I'd rather have this posted out beforehand and have time to think about it. And it really is, like Deirdre said, having that conversation and saying how is best for you to complete them and what way would you like to complete them yourself.
Thanks a million, Aoife. We have a really practical question around the community connectedness scale and somebody looking to find it. Alicia, could you say a little bit about that scale? Because I know that we had challenges finding an appropriate community connectedness scale. And also, I believe it's in the report, isn't it, in the appendix, so people will be able to find it there. But if you could just give a little bit more information about that scale, Alicia.
Yeah, that's right. It is in the report, just at the back of the report in the appendix. I suppose it's as a result of the data outcomes framework, Aisling, where we knew that, you know, it was important to monitor or look at outcomes in relation to both well-being and that social connectedness, because social connectedness is such an important part of social prescribing. So I suppose we set out in the journey to look at it for an appropriate social connectedness, community connectedness type tool. And I suppose, you know, through that process, we realised that there wasn't one that really spoke to the work that's being done through social prescribing. So we then looked at the adaptation of the social connectedness scale that was developed by Dún Laoghaire-Rathdown Social Prescribing Service. So we went through a process where we co-adapted and co-developed that scale in consultation with link workers, but also in consultation with our advisory group, our social prescribing advisory group. And I suppose, you know, this research, we wanted to kind of test the social connectedness scale, but I suppose whilst also being very clear that this isn't a validated tool, so it's not ready for, you know, I suppose dissemination, if you like. As Deirdre mentioned, we were very keen to look at the validation of this tool. So working with the research team to work on that over the coming months.
Thanks a minute, Alicia. I might come to you next, Emer, and we've talked a little bit about the benefits of outcome measurement. Could you tell me a little bit about, from your perspective, from the HSE regional perspective, what do you think, how important do you think it is for us to capture outcomes?
Thanks, Aisling. Yeah, of course. And thanks, fantastic presentation, Aoife and Deirdre. So I suppose from our perspective regionally, it's around looking at it from a service improvement perspective, really. So while absolutely at some point in the future, it would be fantastic to have that opportunity for standardized data across all of our services. But now, like in the now, I think it's really about supporting and working with social prescribing services, really around the delivery of that quality service. So I suppose across our health service and the community partners we work with, there is that strong commitment to improve the quality of care. So I think it's really around making sure that we have that outcome data. And it's only when we have that we can then make those informed decisions about the services being offered. So yeah, I think for us locally, it's really about supporting our partners in delivering that quality service.
Brilliant. Thanks a million. And Alicia, to you then, from the national perspective, how do you think this, you know, this data can inform work happening nationally and inform policy decision making?
Yeah, I think I suppose there's a few points on that. This has been such an important piece of research, you know, that Deirdre and Aoife have carried out, and huge thanks to Deirdre and Aoife for all the work that they put into it, and also to our link workers and service users, as you mentioned, Aisling, for taking part in the research. But really the research, gives us a really good insight into, how these measures work in practice. These standardized measures around mental well-being, how do they work in practice and whether they're feasible to deliver in practice. So I think from what we can see in the report, that there's huge benefits to putting in place standardized outcome measures in terms of the relationships between the link worker, the service user, having a clearer understanding of where the service user is at and in terms of their emotional well-being. And also, I suppose, we've heard about providing the structure to the service kind of in that first appointment. I suppose from our perspective nationally, we would be encouraging link workers to look at putting in place at least one of the standardized emotional well-being measures, so the MICO or the SWEMWebs. And I think this is really important in terms of link workers' own practice and for the service as a whole. I suppose nationally, we don't, I know you've mentioned this, Aisling, we don't have a specific ask at the moment in terms of the use of one or both of our standardized measures. And that's really got to do with the fact that, we need to have a data management IT system that's in place that can kind of collate that data nationally for us. And that is a real priority for us because we do see the need, from a policy perspective. It's really important that we are able to look at our data nationally to understand how the service is working, to look at changes in mental health and wellbeing outcomes across time as a result of taking part in the service. So I think, it's really important that we have that IT system in place. And I suppose the other element, and it's been touched on already, is the importance of training. In terms of these measures, I think training is going to be really important, and that's something that we can action right now. In order to be using the MICO or the SWEMWebs tool, we need to put in place that appropriate training for link workers. And so many of interesting insights came through from the report around whether it's appropriate to use it in that first appointment or, that need to kind of wait to use the measure. So I think we need to kind of consider all of that as part of our training. And equally, in terms of the MICO, some of the points that came up around changing some of the language within the MICO from problems and concerns to kind of goals. So we do need to look at that standard approach that we're putting in place around the use of these measures.
Thanks a million, Alicia. Etna, to you next. Alicia mentioned some of the things that we need to put in place, and also Aoife and Deirdre outlined it in their report as well, things like training and data collection systems. What do you think are some of the key challenges that we need to address to support link workers and service users in using outcome measures, and also maybe some of the opportunities that are there as well?
I guess the biggest challenge is when the person sitting in front of you, like, it's a person-centered approach and you just want to do the very best you can for them in that conversation. And for some people, it can feel, and I know that the research indicates that most people are really happy to fill them out, and that's great. But for some clients, between a language barrier, maybe early dementia, if they come in very upset, it can be really hard to ask them to fill out additional pieces of paper for some clients. So that can be a real challenge. And some of the questions can be triggering. I mean, it came up in the presentation, particularly how useful do you feel on a scale of 1 to whatever. I mean, that's a really tough question to ask for somebody who's come in to avail of support. You know what I mean? So that can be a really hard question to ask. So I guess sometimes it feels like a burden, I suppose, that you're putting on the service user. Not for the majority, but definitely for some. And in terms of opportunities, gosh, one of the great things about being involved in the research was that for the follow-up well-beings, we did have access to a piece of software on mobile phones where people could follow them up just using like a Survey Monkey type of one. Not everybody availed of it, and it's not everybody that you would maybe submit that to, but for some that did, it was very, very useful. People who didn't need to come in for another appointment, didn't want to come in for another appointment, but maybe you had sent them a few more leaflets or a few ideas on WhatsApp, and they were really happy to send that in. So I'd say that would be a great opportunity. And of course, that all links in then with the IT, which is a big question. But something like that, particularly for the follow-up wellbeing measures, would be a huge opportunity, I would say.
So you think that social prescribing link workers getting that feedback can be really useful for informing your work?
Yeah, absolutely. And harnessing IT for some service users. Some service users would even prefer it, I would say. It would obviously depend on the age cohort and just their comfortableness around technology and that kind of thing. So it was a very, very interesting aspect of the research, because it was my first time using a tool like that.
Great. Aoife and Deirdre, I think that did come out quite strongly in your report. I think particularly some vulnerable service users, there was concerns around using outcome measurement. Could you elaborate a little bit more around what you found there in the research?
Yeah,
take that, Aoife?
Sorry, I will. Yeah, of course. Yeah, it was found that there was some difficulty doing the outcome measures with some service users, whether it be those who were maybe emotionally vulnerable or who had some form of dementia or Alzheimer's, or even there was service users who were identified as having maybe schizophrenia or were going through a major depressive episode. And it was through conversations with the link workers, it was identified that it was very difficult to get those baseline questionnaires completed, with follow-ups being even more difficult. It was next to impossible to get them done. But what the service users were saying was just maybe it was that flexibility piece of developing that relationship during the first appointment and meeting the service user and being taken around the centre and talking about what's available to them, and then at that subsequent appointment being able to complete the questionnaire, having that space, or even going home with the questionnaire and being able to think about it and take time and have their own space to read, understand how they really felt. So that was kind of, that flexibility piece was really what was highlighted for me anyways, when I was understanding what both service users and link workers wanted. While it is optimal to complete the questionnaires at that first appointment, sometimes for those more vulnerable service users, it's not possible, or it's more appropriate to complete it at that second appointment, which it is recognised in the report.
Yeah, thanks a minute, Aoife. We have a question from Lisa Seeker Jameson just around the potential for a development of a tool that capture all these outcomes, and she's noting in particular something that might include physical activity, because I know you've noted, Aoife and Deirdre, that that's a gap in the tools that we've looked at. I might come to you, Alicia, on this one. Just if you've any thoughts on whether we could look at having just one tool that would capture all of these outcomes together.
Yeah, that would definitely be the ideal to work towards that. Yeah, like this is an ongoing issue, I think, with data collection with our social prescribing services, not just nationally but internationally. We see that there are multiple different standardized measures and also non-standardized measures being used across our social prescribing, and the fact that social prescribing is targeting so many different outcomes, it makes it incredibly difficult to both evaluate and demonstrate impact. So yeah, I think ideally if we could move towards having some kind of standardized approach, I do think it's a really important point in terms of the physical health. We do know that social prescribing does have an impact on physical health, so it is something that we need to consider, as part of a suite of measurement tools. I think, what's important for us is having that consistency across our services around what we're collecting, and having that capability to collate that data nationally to be able to look at that. And I think being able to have that consistent approach will really help us in terms of making the case for continued funding and ongoing funding for expansion of our services. But would love to get Deirdre and Aoife's views on how we go about that.
Any thoughts for us, Deirdre and Aoife?
Well, I think as Alicia was saying, the whole kind of international movement is to try and, to identify a core outcome set for social prescribing. And that will include, a number of standardized assessments that would be relevant. I think it's really difficult, Aisling, to try and have one measure that's going to capture, the range. outcomes and service users that attend social prescribing, and previous work that we've done, the research and evaluation, the All Ireland Social Prescribing Network. We did a piece of work around, you know, what tools people are using and what recommendations. And again, you know, the one thing that keeps coming out time and time again is how, you know, the variety, and that, you know, you need like almost like a suite of assessments to be able to choose from. And I suppose that goes back to my point around, I think it's really important, you know, as you know, individual services, what are the objectives? You know, what is the main outcome of your service, or, you know, who kind of what's the service user profile? And then having that suite of assessments like your MICA, your swim webs, you know, the physical assessment questionnaire, the social connectedness, the community connectedness, and then you choose based on that, you know, match the kind of the profile of people coming to the service with those, you know, suite of assessments. And then at least we'll get some commonality. You know, it's not tying people down to a specific 1 or 2 assessments, but maybe 4 or 5 that they choose based on their service.
Can I just add to that, Deirdre? Like, I think the report, you know, really highlighted that quite well in terms of the differences between the likes of the MICA and the swim webs, despite the fact that they're both, you know, looking at mental well-being, but you know, in terms of what they're looking at is quite different. You know, that swim webs is much more client focused, flexible. It's really about trying to kind of unpack the needs of the service user in terms of, be it psychological, be it social, be it physical. And then, you know, being able to look at that in terms of the types of activities you might want to refer an individual into, versus that's the MICA, the swim webs is much more focused on, you know, a point in time and looking at a person's emotional well-being from that point, and then being able to track it through. So I think, you know, the report really captures that. Whilst you have different standardized approaches, they have different values and purposes.
Yeah. And I think that's important. You know, I think we didn't want to kind of pigeonhole, you know, services into 1 or 2 assessments. And I think that really, you know, as you say, the research can certainly verify that. And I think, you know, we've got to be cognizant as well that, again, you know, somebody was talking about using the measures with people who are, you know, have visual difficulties. I think we've got to be cognizant that this piece of research did just look at, you know, maybe a small group of service users. And again, the variety of people who attend social prescribing. I think, again, that, you know, we need to do more research, Aisling, in terms of trialing the different measures, different age groups, different, you know, abilities, educational levels, you know, access to technology, you know, all of those variables that we see in terms of, you know, people coming to social prescribing.
And on that topic of future research, Deirdre, do you have any thoughts for us on terms of other research that we should be looking at into the future, building that evidence base for social prescribing?
Yeah, where do you start? It's there's so much, I suppose. You know, everybody wants to kind of look at the effectiveness of social prescribing, Aisling, and you know, there's different ways to do that. I think that's really important to say that you know, there's a lovely study going on out of Galway at the moment. Alicia and Orla are coordinating with the Galway crew there, doing a realist evaluation. That's going to be just so important. You know, how does it work? You know, what works? When does it work? And then maybe trying to do. I know people don't like randomized control trials, and particularly I think in social prescribing, but there is a place for them as well. It's really interesting because on Thursday, the global network of social prescribing is doing a webinar around the use of RCTs in social prescribing. And, you know, there is a place. We're not saying it's the only type of research that should be done. I think that the whole kind of economic evaluation piece, the social return on investment is important. And then the other area that you know, a lot of, you know, government and health systems, again, because of my involvement in the global network, that they're looking at is children and young people. You know, it is a huge area of potential for social prescribing. And then we need to be looking at, again, how does it work? What's the best model? What's the best approach, you know, for that age group? So, so there's loads to be done in terms of the research. It's
Thanks,
very
Evelyn.
exciting.
Absolutely. There's a question in here from Katharina Brady. I suppose this is a more general question around when getting the post feedback from service users. A question: did we find any positive or negative bias towards social prescribing link workers when completing the questionnaires? So, and somebody else echoing that sometimes service users might want to give positive feedback because in case they might think it might jeopardize the service. Any thoughts from anybody on that particular question?
There was that element of bias that we took out by myself doing the interviews with the service users. So they were able to express if they did have any positive or negative reactions to social prescribing in general or their link workers. So we did have that. There was 2 or 3 link workers who did express that sometimes they felt that link or service users completed the questionnaires as a way to continue their involvement in social prescribing, as a way to you know, keep in with it, and I have to do it, without really engaging with that emotional piece sometimes. So while it wasn't reflected by service users that they reported that they inflated their scores because the link worker was there, it was expressed that it could happen by the link workers.
Yeah.
Thanks,
I
Aoife.
think,
And there could also be deflation as well, I would say. I think sometimes the person wants you to know they're in a really tough situation and they're communicating that to you partly by identifying low numbers. Do you know what I mean?
Absolutely. Yeah.
It's very complex.
It is complex, and it's important, you know, that link workers have an opportunity to identify that. And so there's the advantage of the link worker doing it. But then I suppose, as we were saying earlier, also maybe looking at other ways that people could objectively return those kind of follow-up questionnaires as well, Aisling. And, you know, it doesn't have to be very, you know, sophisticated systems. You know, Aoife was able to set up the Google form quite easily. And then, as Ethan was saying, it was accessible on the phone. So, you know, I think just it's down to having those different approaches. Different systems.
We are almost out of time. Just before we wrap up, I'd just like to just quickly ask each of you if you have one key takeaway from this piece of research that you'd like to share. And Lisa, my colleague, has put into the chat there a post-webinar survey link. We'd really love your feedback. So if you have a few minutes to spare, we'd really appreciate it if you could complete that. So I might start with you, Emer.
Thanks. Yeah, I suppose optimism. This is, you know, we're adding to the evidence base all the time.
Thanks a million, Emer. Aoife?
One piece I took away was the trust and relationships that service users were building with their link workers, and I felt that was really powerful, something that I found throughout the research.
Absolutely. Deirdre?
I suppose actually, you know, there isn't a one size fits all in terms of evaluation, and that, you know, it's really important that we have, you know, that choice and options in terms of how to assess and evaluate. And I think, kind of, even though the report it showed a lot, it kind of also unearthed some kind of new questions. So again, you know, lots more work to be done.
Thanks, Deirdre. Alicia?
Yeah, I think probably a sense that we're, you know, we are moving towards a more standardized approach. When you see where we come from with our data outcomes framework, to this piece of research to now thinking about next steps. I think there's kind of progression, hopefully in the right direction towards that more standardized approach to data collection.
Thanks, Alicia. And finally, last but not least, Ethna.
I would say my big takeaway is that it was great to learn from the research that people don't mind filling out the wellbeing forms, because I think many other link workers feel bad asking to fill out paperwork, and it was absolutely great to learn that from the research.
Brilliant. Thank you all so much. Thanks a million to Aoife and Deirdre for the work and for presenting it so well today, and to you all for joining us on the panel. A huge thank you to lots of colleagues in the background as well. My colleague Orla Walsh, to Lisa, to Fergal, to Noreen. Really appreciate all the support and work in the background. We didn't get a chance to cover all of the questions today, so we'll follow up, and a few of the questions were out of scope with our topic of outcome measurement today, but we will follow up, and please do give us your feedback as well in the post-webinar survey, just on any other topics that you'd like to explore into the future. We will be bringing the findings of this report back to our HSE Social Prescribing Advisory Group. And as Alicia has said, it is a priority for us to look at training and to look at the digital solution and to look at how we progress and move this work forward. But just thank you all so much for your time, and we hope you found it useful. And we look forward to seeing you again. Thanks very much, everybody.
Thanks, Aisling.
Thanks, everyone.
Thanks.